All right, welcome back, everyone. Today we're going to be diving into a topic that I think a lot of people are kind of curious about, but maybe a little hesitant to talk about ejaculatory
Right,
disorders.
right.
We're talking specifically about things like premature ejaculation and delayed ejaculation, things that can, really affect a man's, confidence and his relationships. And
Absolutely.
we got a big stack of research from the American Urological Association. And, to be honest with you, it was a little intimidating at first.
Yeah, it's a lot.
But once we started going through it,
Mhm.
I was like, wow, this is really interesting stuff.
Absolutely. There's a lot in there.
And one of the things that jumped out at me right away was, they're talking about how like 30% of men self-report
Yeah.
experiencing premature ejaculation at some point, which is like, that's a huge number.
Yeah.
But then, very few of those men actually, get a clinical diagnosis. So
Yeah.
so what's the disconnect there? What's going on?
Yeah, that's a great question. And that's something that the research really tries to get into, really trying to understand what's happening there.
So to help us kind of break all this down and really understand what's going on, we've got our expert here with us today.
Absolutely.
I'm really curious. You went through all this research. What are the things that really stood out to you? What are the biggest takeaways that you think our listeners should really know about this?
Well, I think the first thing to understand is that we're not talking about some, you know, specific time limit here.
Right.
It's not about trying to, set a record or anything like that.
Right.
The real key here is control and distress.
So what does that mean? Practically speaking.
Well, it means that if a man is ejaculating sooner than he wants to, and it's consistently causing him distress, then it might be premature ejaculation or PE, as it's often called.
Mm.
But, if he's perfectly happy with, how quickly or not quickly he ejaculates, then it doesn't really matter, right? It's not a disorder.
So it's really about how the man himself is experiencing it,
Exactly.
not just, looking at a clock.
Not about the clock, right?
Now, what about delayed ejaculation?
Right.
Is that just the flip side?
So it's similar in that it's about, control and distress.
Oh, wait.
But the experience is different. With delayed ejaculation, also known as DE, a man might have difficulty reaching orgasm at all,
Okay.
even when he's aroused and he wants to ejaculate.
Right.
Or it might take, a really long time, again, to the point where it's causing him distress.
Okay.
So it's really about that distress component.
Now, you mentioned that both PE and DE can be lifelong or acquired.
Right.
What's that distinction?
So lifelong PE means that, a man has always experienced these challenges with ejaculatory control.
Right, from the beginning.
Right from the start. Yeah, from the
Yeah.
very beginning of his sexual life. Acquired PE, on the other hand, develops later on after a period of, relatively normal sexual function.
Hmm.
And the same applies to DE, lifelong, meaning it's always been present, and acquired, meaning that it developed later on.
So something changed
Yes, some change.
in those acquired cases.
Exactly.
Is that like a red flag that there might be something else going on medically?
It can be.
Right.
And that's why, a thorough medical evaluation is so important.
Okay.
For example, acquired PE could be a symptom of diabetes,
Okay.
thyroid issues,
Uh-huh.
prostate problems.
So it's not
It's like a clue that needs further investigation.
it's not just what's happening, sexually, but it could be a sign of something bigger going on in their health.
Exactly. And that's why it's so important to, see a doctor, get things checked out.
Now let's go back to that statistic for a second.
Okay.
The 30% of men self-reporting PE. If it's really about control and distress, why are so many men like reporting this issue?
I think that's where societal expectations really come into play.
Oh,
I mean, men are bombarded with messages about, sexual performance,
Right.
often unrealistic ones.
yeah.
And so they might feel this pressure to, last longer,
Yeah.
even if they're perfectly happy with their own experience.
Right, like they're comparing themselves to something that maybe doesn't even exist.
Exactly. Some kind of, mythical ideal.
What about delayed ejaculation then?
Yeah.
I mean, isn't the expectation, kind of that a man should want to go all night?
Yeah, and that's a great point.
So why would somebody be distressed about taking longer to climax?
Yeah, and that really highlights how complex these issues are.
Okay.
For some men, DE can create the sense of inadequacy, like
Yeah.
there's something wrong with them.
Okay.
And it can also lead to a lot of frustration and resentment in relationships,
Ah.
especially if their partner feels like their needs aren't being met.
So i- it's it's not just about the individual. It really affects the whole relationship.
Absolutely.
It sounds like, no matter whether you're talking about PE or DE,
Right.
there's kind of this pressure on men to perform in a certain way.
There is, and that can be really challenging.
And maybe that pressure prevents some guys from even, wanting to talk about it or seek help.
I think that's absolutely true.
Now, okay, so let's say a guy, he does want to seek help.
Right.
How does a doctor actually diagnose these disorders?
Yeah.
Is it just as simple as, asking them how long does it take?
It's definitely more nuanced than that.
Okay.
Doctors will take a really thorough medical history,
Okay.
considering, any pre-existing conditions or medications the patient might be on.
So they're really kind of playing detective a little bit.
Absolutely, trying to get the whole picture. They also need to really understand the man's relationship and sexual history,
Oh, okay.
really digging into those key elements of control and distress.
Right.
And to get a clearer picture, they might use these validated questionnaires,
Okay.
these tools that help, kind of standardize the assessment
Okay.
and provide a more objective measure of the symptoms.
So it's not just like a casual conversation. There's actual protocols in place.
Absolutely. These are recognized diagnostic tools.
Now, if a man is diagnosed with acquired PE,
Right.
you mentioned, that they might need additional testing.
Right.
Could you give our listener a little more insight into what that might look like?
Sure. Yeah. Depending on what the doctor suspects might be the cause, they might order blood tests to check for things like diabetes or thyroid issues.
Okay.
They might examine the prostate to rule out any problems there.
Uh-huh.
It's really about looking for any underlying medical conditions that could be contributing to the PE.
So you're kind of peeling back the layers of the onion
Exactly.
to see what's really going on.
Trying to get to the root of it.
Sometimes what seems like, a purely sexual issue could actually be
Absolutely.
a symptom of something totally different.
Right. It could be a sign of something else entirely.
And that's a good reminder that our bodies are really complex
They are.
and everything's kind of interconnected.
Everything's connected.
So we've talked about how these disorders are defined,
Right.
how they're diagnosed,
Uh-huh.
but the question that I think is on everybody's mind
Yeah.
is,
Yeah.
can they be treated?
Well, and the good news is,
Yeah.
yes, there are effective treatments available for both PE and DE.
Okay, good.
And in many cases, a combination of approaches works best.
All right, so let's dive into that.
Let's do it.
We'll get into the treatment options for both PE and DE when we come back.
Sounds good.
So let's get into some of those treatment options.
Okay.
I know this is what a lot of people are really, really curious about.
Absolutely.
So let's start with premature ejaculation, PE.
Okay.
What are some of the things that that can be done? What are some of the most effective approaches for treating that?
Well, one of the first-line treatments for PE is actually a type of medication that you might not expect.
Okay.
Antidepressants.
Oh, really?
Yeah, specifically SSRIs.
We're talking about a sexual issue, not depression.
Right. I know it seems a little counterintuitive, but while SSRIs are primarily used for mood disorders,
Mm-hmm.
they have this kind of interesting side effect.
Okay.
They can delay ejaculation.
Huh. How does that work? How do antidepressants delay ejaculation?
So SSRIs work by increasing the level of serotonin in the brain.
Oh, okay.
And serotonin seems to play a role in regulating the ejaculatory reflex.
Okay.
So by boosting serotonin, SSRIs can actually help men gain better control over their ejaculation.
So it's like a happy accident almost.
Yeah, kind of, sometimes these things happen in medicine where a medication that's designed for one purpose ends up being helpful for something completely different.
Are there other medications that are used besides SSRIs?
Yeah, there are a couple other options that work in a similar way to SSRIs.
Right.
There's clomipramine and duloxetine.
Okay.
Both of those are also antidepressants,
Uh-huh.
but they can be taken, just a few hours before sexual activity for a more targeted effect.
Also, depending on, the individual and their needs and their preferences, it might be a daily SSRI or something that they just take right before.
Exactly.
Okay, interesting. What about those topical anesthetics we hear about?
Yeah.
Do those actually work?
They can be helpful for some men.
Okay.
these are creams or sprays that you apply to the penis to reduce sensitivity.
Right.
The idea is that by numbing the area slightly,
Yeah.
you can delay
So
ejaculation.
it's kind of like a more direct approach, right? You're targeting the physical sensation.
Right, it's a more localized approach.
Okay, okay. Now, you mentioned earlier that often a combination of approaches works best.
Yeah.
Um, what else is usually involved besides medication?
So behavioral therapies are really important, either alone or in combination with medication.
Uh,
These therapies help men develop techniques to better control their ejaculation.
Okay.
For example, the stop-start technique
Okay.
or the squeeze technique are commonly used.
Can you break those down a little bit for our listener?
Sure.
I'm not sure everybody knows what those are.
Yeah, so the stop-start technique involves stopping sexual stimulation just before you feel like you're about to ejaculate,
Okay.
and then starting again once you feel more in control.
Okay, so you're kind of like interrupting the process to kind of regain control.
Exactly, you're giving yourself a little break.
Okay.
The squeeze technique is similar, but it involves squeezing the head of the penis for a few seconds to reduce arousal.
So it's like a physical cue to kind of like
Right.
calm things down a bit.
Exactly.
Interesting. Interesting. So it's really about recognizing those physical signs and then knowing how to interrupt the process.
Being aware of your body and what's
Yeah.
happening.
Yeah. Okay. And then I guess beyond just these specific techniques,
Right.
therapy can also help men address, any sort of psychological factors that might be contributing to PE.
Absolutely.
The things like, performance anxiety or stress or maybe relationship issues, all those things can play a role.
All of that, yeah.
So PE often has, a pretty strong psychological component.
Yeah, I mean, for a lot of men, it's really about the anxiety and the pressure that they're putting on themselves.
And so addressing that can be really important.
It's crucial for long-term success, I think.
Okay, so we've got medication, we've got behavioral techniques, and we've got addressing those psychological factors.
Right.
It sounds like a pretty comprehensive approach.
It can be.
Okay, now what about delayed ejaculation? You mentioned earlier that treatment for DE can be a little trickier.
Yeah.
Why is that?
Well, DE is often more complex because it can be rooted in a wider range of factors,
Yeah.
both psychological and physical.
Right.
While PE tends to be more directly linked to anxiety and performance pressure,
Mm-hmm.
DE can stem from things like relationship problems, past trauma, even certain medications.
Oh, wow.
So it's not just about trying to achieve orgasm. It's
Yeah.
really about understanding the whole person and their experiences.
So it's even more important, I guess, to have that really thorough assessment
Absolutely.
to figure out, what are all the pieces of the puzzle.
Exactly. Trying to identify all the contributing factors.
Okay, so what are some of the first steps then in treating DE?
Well, as with PE, a thorough assessment is crucial.
Right.
The doctor will want to rule out any underlying medical conditions,
Wow.
things like low testosterone, thyroid issues, neurological problems. They'll also want to get a sense of the man's emotional well-being, his relationship dynamics, any medications he might be taking.
Right. It's like we were saying before. It's really about putting together that whole puzzle and
Exactly.
figuring out, which pieces are contributing to the DE.
Right.
And often the solution involves a multifaceted approach, right?
Absolutely.
It's not just one thing.
Rarely just one thing.
Mm-hmm. Okay. And you mentioned therapy. Therapy is almost always.
Yeah, almost always a key component.
So if somebody's kind of hesitant to see a therapist,
Yeah.
would you say it's absolutely essential in cases of DE?
I would strongly encourage it.
Okay.
Therapy provides a safe and supportive space to really explore the underlying causes of DE
Okay.
and develop strategies for overcoming it.
And that's true, even if there's not like a specific trauma or something like that.
Right. It can still be really helpful to have that space to talk things through.
Okay, so therapy is one piece of the puzzle.
Right.
What are some other pieces?
Well, sometimes medication adjustments can make a difference.
Oh, okay.
We talked earlier about how certain medications, particularly antidepressants,
Yeah.
can actually contribute to DE.
Right.
So if a man is experiencing DE as a side effect of a medication, maybe adjusting the dosage or switching to a different drug might help.
So it's always worth talking to your doctor about any medications you're taking,
Always.
even if they don't seem related to sexual function.
Absolutely, because you never know.
Okay. And then I guess in some cases, hormone therapy might be an option.
Right. If a man has low testosterone,
Okay.
which, can be more common as we age,
Okay.
testosterone therapy might help improve his overall sexual function,
Okay.
including his ability to reach orgasm.
So we're really looking at the whole picture,
The whole picture.
emotional well-being, physical health, medications.
It's all connected.
It's a lot to consider.
It is.
Now, I'm curious, for both PE and DE, we've been focusing a lot on the man's experience,
Right.
but how does all this affect their partner?
Well, both PE and DE can put a real strain on the relationship.
Okay.
Partners might feel frustrated, rejected, even resentful if their sexual needs aren't being met.
Right.
And the man might feel this intense pressure to perform,
Yeah.
which can actually worsen the problem.
So it's like this vicious cycle.
It can be, yeah.
So communication is really important.
Communication is key.
Being able to talk openly and honestly
Yeah.
about these things
Right.
without judgment or blame.
Right. It's about creating a safe space for both partners to share their feelings and their needs.
So it's not just about finding the right treatment.
Right.
It's also about fostering a healthy and supportive dynamic
Absolutely.
within the relationship.
The relationship is a huge part of this.
And often, couples therapy can be incredibly helpful
It can be so beneficial.
for navigating these challenges.
Yeah, it can help couples learn how to communicate more effectively and work together to find solutions.
So, seeking help, it's not a sign of weakness.
No, not at all.
It's a sign of strength, I think,
I agree.
and a commitment to the relationship.
No, absolutely. It shows that you're willing to put in the effort.
Now, I'm curious, as you were going through all this research,
Yeah.
was there anything that really surprised you?
Mm.
Anything that stood out as particularly interesting or maybe unexpected?
Yeah, one thing that really jumped out at me was just how much the research emphasizes the psychological and interpersonal aspects of these disorders.
Yeah.
It's not just about, the physical mechanics. It's
Yeah.
about how men view themselves,
Uh-huh.
their relationships,
Uh-huh.
and even societal expectations around masculinity.
So it really is, like we've been saying, it's about the whole person,
You're right.
not
Yeah.
just their genitals.
Right. It's about the whole man.
And I think that's an important shift in our understanding of these issues,
I think so too.
because it helps to, kind of move us away from that shame and stigma
Absolutely.
and toward a more, kind of holistic view of men's sexual health.
I agree. Yeah.
So instead of seeing it as like a personal failing, we're recognizing that these issues are often connected to, these deeper emotional or relational challenges.
It's not just about willpower.
Right.
Or something like that.
Which I think is a really powerful message,
It is.
and hopefully, encourages more men to seek help if they need it.
Yeah, without feeling embarrassed or ashamed.
Right, because the truth is, these disorders they're really common,
They are.
and there are effective treatments available.
Absolutely.
Just knowing that you're not alone
Right.
can make a huge difference.
I think so.
But as we've been talking about this, I keep coming back to something that I feel like is missing from the research.
Oh, what's that?
Well, we've been talking a lot about, heterosexual experiences, but the research really doesn't say much about ejaculatory disorders in non-heterosexual
Right.
men.
Yeah.
And I wonder if there are, unique challenges there.
Yeah.
Or differences in how these disorders might present, or
I think that's a really great point.
yeah.
And it highlights an area where we definitely need more research.
Right.
We need to make sure that our understanding of these disorders and our treatment approaches are inclusive and relevant for everyone.
Right, regardless of their sexual orientation.
Exactly.
It's not safe to assume that everybody's experience is going to be exactly the same.
No, not at all.
And this brings up, I think, a broader point about the importance of, cultural sensitivity in healthcare.
Absolutely.
I mean, different cultures have different norms and beliefs, and those factors can, influence how men experience these issues.
Right.
And how they seek help.
Yeah, it can affect how comfortable they feel talking about it.
So a treatment that might be effective for one man
Right.
might not be appropriate for another,
Exactly.
depending on, his cultural background.
It's about individualized care.
Right.
Understanding the whole person in their context.
And that's why it's so important to have those open and honest conversations
Absolutely.
with your healthcare provider.
They need to understand your needs,
Right.
your concerns,
Right.
to provide you with the best possible care.
Well, this has been a really, I think, eye-opening deep dive.
Yeah, it's been a great discussion.
We've covered a lot.
We have.
We talked about the definitions of PE and DE, the causes, the different treatment options. But but most importantly, I think we've really challenged some of the common misconceptions.
Yeah, the myths.
Yeah, that surround these disorders.
Hopefully we've cleared up some of those.
And I hope our listeners, they've come away with a better understanding of these issues.
Me too.
And feel, a little bit more empowered to seek help if they need it.
That's the goal.
So if you're out there listening
Yeah.
and you're struggling with PE or DE,
Yeah.
just remember, you're not alone.
You're not alone.
These disorders are more common than you might think.
They really are.
And there are effective treatments out there.
So don't suffer in silence.
Yeah, don't let shame or stigma prevent you from getting the help that you deserve.
Reach out to a healthcare provider.
Absolutely.
Or a trusted resource.
There's no need to go through this alone.
There's support available.
And on that note, we're going to wrap up this deep dive.
Okay.
We hope you found it informative and helpful.
I hope so too.
And until next time, happy exploring.